From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday, and February is American Heart Month. So joining me now is Dr. Chris from Christus Good Shepherd Health System, and he's here to talk about all the things heart-related. How are you doing today?
I'm doing great. Thanks very much for having me.
Yes, sir. So Dr. Chris, tell us a little bit about Heart Month and why we put so much emphasis on awareness.
So the reason we emphasize Heart Month is because heart disease, heart attack, and stroke is by far the most common thing that people die from in our country. When I was a medical student back a million years ago, we thought that women died of breast cancer and men died of heart attacks, and now we know that's not true. Both men and women far more commonly die from heart attacks and stroke. In fact, women in particular die more from heart disease than all forms of cancer put together.
Wow. Yes, sir. So you've been a doctor for a long time.
Long time.
Yes, sir. So what kind of advancements have you seen in heart care?
Oh gosh, since I was in training back in 2004 was when I finished in Virginia, and the changes that have come on since that time have been unbelievable in all aspects of medicine, but in cardiology in particular, whether it's diagnostics or therapeutics, actually fixing problems, and in each of the individual specialties. I'll give you some examples. Back in the day, to figure out if someone had a blocked artery, we would do a stress test. And we still do stress tests on people sometimes, but now we have a much better technology, a CT scan of the heart, a CT angiogram. We can actually look inside the arteries of the heart. It's like having a heart catheter test, except I don't have to put a catheter up in your heart anymore. We can get pictures from the outside just with a little IV in your elbow. Much more accurate and gives me a much better idea of what the patient is going to have even before they get to the cath lab in the first place. Wow. Cath lab technology has improved dramatically. At my campus, Christus Good Shepherd in Longview, for example, we have two brand new $1 million+ cath lab, state of the art, where we can get unbelievable image quality, but at a fraction of the radiation dose compared to what we used to get. That makes heart caths much safer. We also have these cath labs in the outpatient setting, so patients don't even need to go to the hospital to get their care. They can check in, get registered, have their cath done, get a stent put in their heart, and go home the same afternoon with a Band-Aid on their wrist. That was not available 20 years ago, I can tell you that. Nowadays, we're able to fix even complex heart valve disease without even having an open heart surgery. Through a procedure called a TAVR or a TAVI, we can go through the groin and implant a heart valve in the aortic position in patients without even need to do open heart surgery. That procedure is actually the most common way that aortic valves are fixed these days in the United States, and we're fortunate enough to have experts in this area in East Texas who are able to do it. I recruited a brand new fellow at Good Shepherd Longview. Nowadays, these guys are doing an extra year of training on top of all the other training they're doing just to get good at those complex procedures. One of the biggest advancements has been in electrical medicine. I remember 20 years ago, again, when I was in Virginia as a fellow, they were just starting to talk about, hey, maybe we can fix atrial fibrillation, a very common rhythm from the top part of the heart that comes on more and more as you get older, puts people at risk for strokes. Back then, all we had available were medicines to try to slow people's heart down and blood thinners. Nowadays, we have the option to ablate atrial fibrillation, try to actually maybe fix it where it may not come back, or at least come back much less frequently, and even procedures to implant a device where patients don't have to be on blood thinners anymore at all. It's really come a very, very long way in a short period of time.
Yes, sir. And so what can people do to better their heart health? Is it just diet and exercise? Or?
Yeah, my old instructor used to say, if it tastes good, spit it out. And so there's probably some truth to that, right? But we know that the American College of Cardiology recommends exercise at least 5 days a week if you're able, ideally 30 minutes or more. There's some interest in high intensity interval training, you know, walk, run kind of thing. And then in trying to maintain a good weight and avoid eating sugary kind of things like that, and you know, high fat foods and those kinds of things are important too. Obviously, no smoking. And but a lot of heart disease really is predicated on your genetics. And so even people that try as hard as they can with diet and exercise may have a very hard time modifying their risk because of their genetic history. If your parents or your brother or sister had an early heart attack, you definitely need to go get checked at an early age to try to protect yourself from having that same problem early on.
Yes, sir. And so what type of symptoms should people be on the lookout for?
So classic symptoms are chest pain, which can be described as squeezing or tightness in the chest, usually when you exert yourself, but it can come on at rest. Now that's the classic textbook symptom, but not everybody has chest pain. Some people have new shortness of breath when they exert themselves. So think about a guy who used to play 9 holes walking with his friends, and now after 2 holes, he just can't go anymore. That's something that needs to be checked out right away. Those symptoms can come on with sweatiness or nausea, vomiting. Unfortunately, we think a third of patients who have severe blockages in their arteries do not have any of the common symptoms. And so that's one of the reasons that we're interested in technology like those CT scans I told you, calcium scores, to try to catch cardiac disease early on before patients show up in the heart attack with their first heart attack. Before in the ER with their first heart attack. 1 out of 3 people, the way we find out they have heart disease is they come in the emergency room with a heart attack or have sudden death. The idea behind Heart Awareness Month is to try to change those numbers so that we can diagnose things up front before people have those bad complications.
Yes, sir. And where can people get more information?
Well, there's lots of websites, American Heart Association website, etc. Obviously, your primary care doctor is a great source. Christus has websites available talking about heart disease and highlighting many of these new technologies we have available on our campuses as well.
All right. Well, thank you so much for coming in.
Thank you very much. I appreciate your time.
Yes, sir. For more information, go to the website right there on your screen.